I'm going to tell you something that might shock you. Last week, a patient came to Melate's call her Margaret, a 68-year-old grandmother, and she told me she'd completely stopped eating apples. Not because she didn't like them, not because of her health. She stopped because she was terrified her teeth would fall out. And here's what surprised me. Margaret had perfectly healthy teeth, but she believes something that millions of seniors believe, something that's keeping them from enjoying their grandchildren's birthday cake, from eating corn on the cob at family barbecues, from living their lives fully. That myth, it's one of 10 dangerous misconceptions about teeth and aging that I'm about to shatter for you today. And trust me, some of what you've been told is completely wrong. Stay with me, because in the next 24 minutes, we're going to cover the myths that are stealing your independence, your confidence, and honestly, your joy. Hi, I'm Dr. Alex Mendel. For the last 22 years, I've worked with seniors just like you. I've seen the fear, the confusion, and the unnecessary suffering that comes from false information about teeth and aging. And I've also seen the transformation that happens when people learn the truth. I want to be clear about something from the start. This isn't a sales pitch. I'm not trying to sell you anything. What I am doing is giving you the medical facts that your dentist should have explained clearly, but probably didn't. If you're over 55 watching this and you've been worried about losing your teeth, you need to hear what's coming. And if you've got family members, kids, grandkids, send them this video too, because they need to know how to protect their teeth now so they don't face what some of you are dealing with. Before we jump in, please, and I mean this video, subscribe to the channel and turn on notifications. We're releasing senior health content every single week that could literally change your life. And sharing this video with someone you love could save them thousands in dental costs and years of unnecessary worry. Now, let me ask you something. Do you think losing teeth is a normal part of aging? Most seniors think losing teeth is inevitable. It's not, and I need you to understand why this myth is so dangerous. I remember speaking with a patient I'll call Roberti, was 71 years old. Robert told me, "Doc, my father lost all his teeth by 65, my grandfather too, so I'm just expecting it." Robert had already decided his dental fate before it was sealed. Here's what shocked Robert. His father and grandfather didn't lose their teeth because of aging. They lost them because of untreated gum disease, poor brushing habits, and lack of dental care. That's not genetics, that's choice. The truth? Teeth are designed to last your entire lifetime. We have 82-year-olds with all their original teeth. We have 95-year-olds with strong, functional teeth, but, and this is important, they maintain them. One of my patients, someone I'll call Helen, came to me at 64, convinced she'd lost the genetic lottery. Her mother had dentures by 70. Helen expected the same, but when we checked her teeth, her gums were healthy, her brushing technique was good, and with a few lifestyle adjustments, she's now 78 with every single tooth intact. What changed? Not her genetics, her understanding, and her daily habits. But here's where most seniors go wrong, and we'll talk about this in a moment. And if this is resonating with you, hit that like button. And seriously, if you know someone who's been worried about this, share this video with them right now. You could be changing their life. The real secret to keeping your teeth isn't what you think it is. Here's a myth that's costing seniors millions. The idea that gum disease is inevitable after 50, that it's just one of those things that happens with age. I need to be very clear. Gum disease is preventable at any age. 50, 60, 70, 80, it doesn't matter. What matters is what you do every single day. Let me tell you about a patient I'll call David. David was 62 when he came to me with significant gum recession. His gums were receding, his teeth looked longer, and he was convinced he'd be wearing dentures within 5 years. His wife was worried. His adult children had started asking him if he was okay. The thing that hurt David most, he felt like he was losing control of his own body. But here's what happened. We taught David 3 simple things, not complicated, not expensive, 3 daily habits. Within 4 months, his gum bleeding stopped. Within 8 months, his gums started to reattach. Within a year, his gum health was better than it had been in decades. Myth. Gum disease is age-related and inevitable. Fact, gum disease is bacterial. It's preventable with proper hygiene and regular professional care. The bacteria that causes gum disease doesn't care how old you are. It cares about whether you're cleaning properly and whether you're getting professional checkups. And I'm about to tell you the one thing most seniors miss when they brush something so obvious that you're going to kick yourself when you hear it. Remember to like and subscribe if you're finding this helpful. We're building a community of seniors who are taking control of their health, and I want you to be part of that. Myth number 3, sensitive teeth mean your teeth are dying. Sensitivity in your teeth can make you panic, and that panic leads to the dentist chair where you're convinced you need a root canal or an extraction. But sensitive teeth usually don't mean your teeth are dying. Let me explain this simply. Your tooth has a hard outer layer called enamel. Under that is a softer layer called dentin. When dentin is exposed, usually from receding gums or worn enamel, cold, hot, or sweet foods can cause sharp pain. I had a patient I'll call Susan. Susan was 66 and had developed significant tooth sensitivity. When she ate ice cream with her grandchildren, she'd get a sharp pain and she'd immediately think, "That's it, I'm losing this tooth." Her anxiety was so high that she was considering having the tooth pulled, but her tooth was completely healthy. The sensitivity? It was dentin exposure, something we could absolutely manage. We used a desensitizing toothpaste. We adjusted her brushing techniques. He was brushing too hard, which was wearing away her enamel. We applied a professional fluoride treatment to strengthen the exposed dentin. Within 3 weeks, her sensitivity was gone. Susan told me later, "I was ready to say goodbye to my tooth. I'm so glad I came in first." Now, if sensitivity comes with pain that's localized to one tooth, pain when you bite down, or pain that lasts after the trigger is gone, that's different. That could mean decay or an infection. That needs professional attention. But simple sensitivity, that's manageable, preventable, and usually doesn't mean you're losing the tooth. Speaking of things you can manage at home, there's a brushing technique that 9 out of 10 seniors are doing wrong, and it's actually making their teeth worse. Myth number 4, brushing harder gets your teeth cleaner. This myth is so damaging and it's so common. Seniors, listen carefully. Harder brushing is not better brushing. In fact, aggressive brushing is one of the main reasons I see tooth and gum problems in patients over 50. Here's the physics. Your teeth are not made of rock. Your gums are delicate tissue. When you brush hard, you're not cleaning better. You're damaging both. Imagine brushing with a hard bristled toothbrush and aggressive force. You're not removing more plaque. You're wearing away enamel and pushing your gum tissue away from your teeth. Over years, this creates the exact problem that scares so many seniors: gum recession. One of my patients, someone I'll call Robert Different Robert from before, came to me at 73 with severe gum recession on his lower front teeth. His teeth looked too long. He was embarrassed. When I asked about his brushing habits, his answer was, "Doc, I brush hard twice a day because my teeth need to be really clean." Robert thought he was taking great care of his teeth. He was actually destroying them. The solution: I taught Robert the gentle technique: small, gentle circles, soft bristled toothbrush, 2 minutes total, not aggressive, just thorough. He felt like he wasn't cleaning enough at first. That's how ingrained the bad habit was. But within a few months, his gum bleeding stopped. Within a year, his gums actually started to reattach. The teeth that looked too long started to look normal again. Myth: brush hard and long to get teeth really clean. Fact: gentle, consistent 2-minute brushing removes plaque effectively without damage. If your toothbrush bristles are frayed at the tips, you're brushing too hard. They should look neat and straight. This is so important that I want to repeat it. Don't brush like you're scrubbing a pot. Brush like you're gently massaging your gums. If you're getting value from this, please hit like and share with someone you care about. This information could literally prevent years of dental problems. But brushing technique is only part of the equation. There's something else that's destroying teeth in seniors, and most people have no idea it's happening. Myth number 5. Dentures are the inevitable end goal. There's a narrative in our culture that eventually you'll lose your teeth and get dentures. It's presented like destiny, like it's just something that happens when you're old enough, and I want to challenge that narrative completely. Yes, dentures exist. Yes, sometimes they're necessary, but they're not inevitable. And if you're thinking about getting them just in case, I want you to understand what you'd actually be giving up. I remember speaking with a patient I'll call Margaret Different Margaret, who was 59 when her dentist suggested she might eventually want to consider dentures. She didn't have serious tooth problems, but her dentist planted the seed. Within a year, Margaret had convinced herself dentures were coming. She started eating softer foods. She avoided certain foods because she thought, "I won't be able to eat them with dentures anyway." She was grieving the loss of her teeth before she'd even lost them. Here's what Margaret didn't know. Her teeth could have lasted another 30, 40, or even 50 years with proper care. Instead, by expecting dentures, she had essentially decided to lose her teeth. Myth: everyone eventually needs dentures. It's just a matter of time. Fact: with proper care, most people can keep their natural teeth their entire lives. Do you know what people who wear dentures miss most? The ability to eat freely, the taste of food, the feeling of biting into an apple, the confidence, the spontaneity. When you wear dentures, you have to think about taking them out to clean adhesive and fit issues, dietary restrictions, how they feel in your mouth, whether they'll move when you talk or eat, the cost of adjustments and replacements. And here's what surprised even some of my colleagues. Most people who get dentures wish they'd fought harder to keep their natural teeth. The goal isn't dentures, the goal is your own teeth for life, but that only works if you understand what's really attacking your teeth, and most seniors don't. Myth number 6, sugar is the main reason teeth decay. Here's a myth that's been drummed into our heads since childhood. Sugar causes cavities. Avoid sugar and you won't get cavities, but that's incomplete. And for seniors, it's dangerously incomplete. Sugar itself doesn't decay teeth. The bacteria in your mouth react to sugar and produce acid. That acid decays teeth. But here's what most seniors miss. The frequency of sugar exposure matters far more than the amount. One of my patients, someone I'll call Patricia, came to me at 70 with significant cavity development. Patricia didn't eat much candy. She wasn't sneaking desserts, but she had a habit, sipping on orange juice throughout the day or lemonade, acidic drinks, sippy sip all day long. Patricia was exposing her teeth to acid constantly. The bacteria in her mouth was having a feast. The problem wasn't the sugar. The problem was the constant exposure. Myth, limit sugar and your teeth will be fine. Fact, limiting sugar exposure frequency is more important than limiting total sugar. And acidic foods and drinks are just as destructive. Here's what ruins teeth in seniors. Constant sipping on acidic drinks, frequent snacking on starchy foods, dry mouth, which reduces protective saliva, acid reflux. And actually, dry mouth is something that affects so many seniors, and it's related to a medication issue that almost nobody talks about. If you're watching this and thinking, I needed to hear this, please like and subscribe. Share this with family members who care about their dental health. You're building a community of informed seniors, and that's powerful. Myth number 7, dry mouth is just a normal part of aging. Dry mouth is one of the most underestimated threats to dental health in seniors, and it's treated like just an annoying inconvenience when actually it's a serious dental risk factor. Let me explain why. Your saliva is like your mouth's defense system. It fights bacteria, neutralizes acid, and helps you taste food and swallow. Without adequate saliva, your teeth are vulnerable. I had a patient I'll call Harold, 67, who developed dry mouth. Harold was on several medications for blood pressure and cholesterol. Nobody told him these medications could cause dry mouth. Nobody connected that dry mouth to his rapidly developing cavities. Within 2 years, Harold went from having 0 cavities to having 4, not because of decay in his habits, because of this invisible threat, dry mouth. When we identified the medications causing the dry mouth, we worked with his doctor to explore alternatives. We also implemented artificial saliva products. Within a year, his cavity development stopped completely. Myth, dry mouth is just uncomfortable. It's not a real health issue. Fact, dry mouth dramatically increases cavity risk and can accelerate tooth decay. If you experience persistent dry mouth, that's not normal. Talk to your doctor. Many medications can cause this, including blood pressure medications, antihistamines, antidepressants, Parkinson's medications, pain medications. Are you on any regular medications? Do you know if they could affect your mouth? Because there's another medication-related issue affecting senior teeth that almost nobody discusses. Myth number 8. You don't need dental checkups if your teeth feel fine. This myth leads to disaster, and I see it constantly. Seniors who haven't been to the dentist in 5, 10, sometimes 15 years because their teeth feel fine. Here's the problem. Early tooth decay, early gum disease, and early oral cancer don't hurt. You don't feel them. By the time you feel pain, the problem is often advanced. One of my patients, someone I'll call Edward, hadn't been to the dentist in 8 years. Edward was 71. He felt fine. His teeth felt fine. But when he finally came in prompted by his daughter, we found significant decay, advanced gum disease, and this is serious early signs of oral cancer. Edward was devastated. His daughter was terrified. 8 years of skipped checkups had allowed serious problems to develop silently. The good news? We caught the cancer early. The gum disease was manageable, but Edward needed more extensive work than he would have if he'd been coming in regularly. Myth, if your teeth feel fine, you don't need a checkup. Fact, most dental problems don't cause symptoms until they're advanced. Regular checkups catch problems early when they're easier and cheaper to treat. Here's what I recommend for seniors. See your dentist every 6 months, not every 2 years. Mention any new symptoms, even ones that seem minor. Mention any medications you're taking. Tell your dentist about dry mouth, acid reflux, or jaw pain. Early oral cancer detection increases survival rates from 50% to 90%. That difference comes from regular checkups. Speaking of things that don't have obvious symptoms, there's a disease affecting senior teeth that most people don't even know they have. Please like this video if you're learning something new. Subscribe and share. This information could literally save someone's life. Myth number 9, root canals always fail in older teeth. There's a belief among some seniors that if you need a root canal after 60, you might as well extract the tooth. Root canals fail in older people, the myth goes. Why bother? This myth is costing seniors their teeth unnecessarily. Root canals don't fail because you're old. Modern root canal success rates are 95% or higher regardless of age. A 75-year-old who gets a root canal has the same success rate as a 35-year-old. The tooth might be older, but the technique is sophisticated. The materials are advanced. The results are reliable. I remember speaking with a patient I'll call Nancy, 74 years old, who needed a root canal. Nancy had heard horror stories. She was terrified. She even asked about extraction as an alternative, removing a tooth that was otherwise healthy just because it needed treatment. Nancy decided to trust the process and get the root canal. 15 years later, she's now 89. That tooth is still functioning perfectly. She uses it every day. She's never had a problem. Myth: root canals fail in older teeth. Fact: root canal success rates are 95% plus, regardless of age. Saving your tooth is almost always better than extracting it. Extracting a tooth creates problems. Bone loss in your jaw starts immediately, gets worse over time. Teeth shifting and misalignment changes in your bite and jaw joint. Additional costs if you want a replacement. Keeping your natural tooth is almost always the better option. But there's another dental procedure that seniors are often scared of, and the fear is usually worse than the reality. Myth number 10. Dental implants are only for wealthy people. The final myth I want to address is about dental implants. There's a perception that implants are expensive luxury items available only to wealthy people. The cost is high, that's true, but the perception is incomplete. Dental implants cost $20,000 to $40,000 for a full mouth. That's not cheap. I'm not going to pretend it is. But let me give you context. One of my patients, someone I'll call Susan, different Susan, was 68, had lost several teeth and was wearing a partial denture. Susan wasn't wealthy. She was a retired teacher on a fixed income, but she was miserable. The denture was uncomfortable. It affected her eating, her confidence, her quality of life. Susan looked at her options. She could continue with the denture indefinitely, or she could invest in implants. It took her 3 years to save, but she did it. When Susan got her implants, her life changed. No more adjustment, no more adhesive, no more thinking about her teeth. She could eat normally, she could smile confidently, she could talk without worrying. Here's what people don't understand about the cost. An implant lasts 30, 40, sometimes 50 years. It's a one-time investment in your quality of life for decades. Compare that to dentures, replaced every 5 to 7 years, thousands in adjustments and repairs. Bridges last 10 to 15 years, then need replacement. Continued dentures, a lifetime of discomfort and restrictions. Myth: implants are only for rich people. Fact: implants are expensive up front, but they're a long-term investment in quality of life. Many seniors find ways to make them work financially if implants interest you, but cost is a concern. Ask about payment plans. Many dentists offer them. Explore dental schools, lower cost, high quality. Consider partial implants instead of full mouth check if you qualify for any dental insurance or assistance programs. The real question isn't, can I afford implants? The real question is, what is my quality of life worth to me? Now that we've covered these 10 myths, let me give you the real actionable plan for keeping your teeth for life. Okay, so we've covered a lot. Let me give you the actual plan, the thing you can do starting today. Step 1, brush gently twice a day for 2 minutes. Soft bristles, small circles. Think massage, not scrub. Step 2, floss daily, not optional, daily. This removes plaque that your toothbrush can't reach. Step 3, rinse with fluoride mouthwash, especially if you've had gum issues or sensitivity. Step 4, monitor your dry mouth. If it's a problem, talk to your doctor about medications or try artificial saliva products. Step 5, get dental checkups every 6 months. Not yearly, every 6 months. Let me tell you about a patient I'll call Richard. Richard was 66, skeptical, thought he was too old to fix his dental problems. Richard had gum disease, some decay, and was convinced he'd need dentures within 5 years. Richard committed to the plan, the daily habits, the checkups. Within 2 years, his gum disease was gone, his teeth were stronger, his confidence was back. Richard told me, "Doc, I can eat anything I want. I feel like myself again." Richard didn't need to extract teeth. He didn't need dentures. He just needed the right information and the commitment to follow through. Think about your life, your grandchildren's birthday parties, family dinners, being able to eat what you want without hesitation, being able to smile confidently. That's what we're protecting here. Your dentist should be your partner in this. If your dentist isn't listening, isn't explaining things clearly, or isn't treating you with respect, find a new dentist. This is too important. And here's something most people don't realize about maintaining healthy teeth as you age. If this video has helped you, please genuinely like and subscribe. We're building a community of seniors who are taking control of their health. And when you share this with someone, you're potentially changing their life. You're giving them hope. You're giving them information that could save them thousands of dollars and years of unnecessary worry. Next week, we're releasing a video on the relationship between gum disease and heart health. You will not believe what the research shows. Subscribe so you don't miss it. Before I finish, I want to say something personal to you. If you're watching this and you've been worried about losing your teeth, I want you to know that worry doesn't have to be your reality. You have more control than you think. I've worked with thousands of seniors. I've seen 80-year-olds with strong, beautiful teeth. I've seen people who thought they were facing dentures completely reverse their dental health. The difference wasn't genetics, it wasn't luck, it was knowledge and action. I remember one patient in particular, someone I'll call Thomas. Thomas was 72 when he came to me. Thomas was depressed about his teeth. He felt old. He felt like his body was betraying him. His wife was concerned. His grandkids had even commented that Grandpa didn't smile much anymore. Within 2 years of committing to the plan, we discussed the gentle brushing, the flossing, the checkups, the understanding of what was really happening. Thomas had his smile back. He was eating freely. He was confident. He was present. Thomas told me something I'll never forget. "Doc, I feel like myself again." That can be you. That can be your story, but only if you take action today. Do this today. Like this video, subscribe to the channel. Share it with someone you love who's been worried about their teeth. Make a dental appointment if you haven't been in more than 6 months. Commit to the daily habits we discussed. You deserve to enjoy your life. You deserve to eat what you want. You deserve to smile confidently. You deserve to be present with the people you love without worry about your teeth. You have the power to make that happen. The information is here. The plan is clear. Now it's up to you. I'm Dr. Alex Mandel, and I'm here for you every week with senior health information that actually matters. Thank you for watching. Take care of those teeth. They're the only ones you've got.